Hello, everybody. This is Dr. Hall. We're going to get started on Lecture 8, which is all about the spinal cord. So if we look at our outline in 8A, which is this part of the lecture, we're going to talk about some basic features of spinal cord anatomy, things that may be review for you. And then in 8B, we're going to talk about a little bit more in depth of some features, things that we'll find kind of within the spinal cord itself. And then 8C, we're going to talk about spinal reflexes, two main types of them anyhow. And then in 8D, we're going to talk about spinal cord injuries. So let's get started with some basic anatomical concepts for the spinal cord. The spinal cord, as you know, is within the vertebral column. So all of the central nervous system is protected by bones. In the case of the brain, it's the skull. In the case of the spinal cord, it's the vertebral column or your bony spine. So those vertebrae are those bones that are stacked one on top of each other all the way up. And you can see in this diagram over on the left here that there is an opening through the middle through which the spinal cord travels. So it is very protected, and yet there's flexibility in the system because each is an individual bone. Now the spine, the bony spine, is divided into different types of vertebrae. So there are cervical vertebrae, which are cervical means of the neck region, and they have a particular structure to them. Then there are thoracic, in the thorax, right? Lumbar, which is down kind of in the low back region, and then sacral, where the sacrum is. So we have kept that convention when we're talking about different parts of the spinal cord. We're going to refer to cervical regions, thoracic regions, lumbar regions, and sacral regions. So we're going to use those as reference points for saying where we are in the spinal cord. The spinal cord does end, and it ends actually before the end of the vertebral column. So the spinal cord itself, the part that is like a solid cord that you can squeeze with your fingers, that ends around the T12L1 area. So you can see that the main body of the spinal cord kind of comes down to a tapered point or a cone in the middle. So that's where the name comes from. Conus medullaris means kind of cone in the middle. And so that's kind of the end of the spinal cord proper, but then there's a whole bunch of nerves that are continuing down through that bony canal to get to levels lower down, and those are referred to as the cauda equina, which is Latin for horse's tail, because it really just looks like a horse's tail with all these things hanging down. So there's a whole bunch of nerves that are coming down there. Now, interestingly, because of that, the fact that there is no actual spinal cord down here, there's just nerves floating in the CSF. If we need to do a spinal tap on somebody, a lumbar puncture, they're actually going to do it around L2. They're going to go in here because they're not going to poke the spinal cord. There are just nerves floating in CSF, and as their needle goes in, if there's a nerve there, it'll just kind of move out of the way and float out of the way. So when somebody has to have a spinal tap, that is where they do it. It's kind of a fun procedure to do. At every single level between those vertebrae, there are nerves coming into and out of the spinal cord. So if we look at this diagram over here on the left, first, you can see kind of a zoomed in view, and you can see here is a nerve coming out. And then at the next level, here is a nerve coming out. So there are these little openings in the bony spine where these nerves can kind of come through at each level. And they do that on each side, and they do it at every single level in between all of the vertebrae. So that's what we're seeing in this larger diagram here. And you're going to see some friends. So let's just remind ourselves of some friends that we already learned about earlier. So one is the brachial plexus. So this is that network. So we've got all these little spinal nerves coming out between these levels of cervical and the first thoracic vertebrae. And look, here are our friends over here, the median, the radial, and the ulnar nerves, the three main nerves of the upper extremity that we learned as coming off as branches from that brachial plexus. Then you'll see we have a whole bunch of these kind of singleton nerves that come out, and they don't make any plexuses. Those are the intercostal nerves. So inter means between, costal means ribs. Haha, that kind of makes sense because they come in between the levels of the ribs because the ribs attach to the vertebrae. So, and then we have the lumbar plexus, which we also learned about. And you might remember that the femoral nerve right here is a branch off of the lumbar plexus, as is the obturator nerve, which they spelled wrong, which is down here and also coming off of this lumbar plexus. And then of course the sacral plexus, off of which is coming, and so I'll just circle it on this side, sacral plexus, off of which is coming that big kahuna nerve, that sciatic nerve, which is supplying the remainder of the lower extremity. Okay. The last big concept is that there is gray and white matter. So just like the brain, we have gray matter, which is mostly, oh yeah, I forgot I was going to show you this. So this picture is a cross section. So if you imagine the spinal cord as this big, long cucumber, right? I mean, obviously it's an up and down cucumber. Then when we make slices and look at them, that is a cross section. So as we talk about the nervous system, we're constantly going to be looking at cross sections of the spinal cord. So I wanted to orient you to this picture. And by convention, it's always shown that the dorsal or posterior side is kind of towards the top of the image, and then the ventral or the anterior is the one that's kind of at the bottom of the picture. So that's what you're looking at. We'll see a lot of these cross sections, so I wanted to make sure you understood what we were seeing. Okay, so as you know, gray matter is neuron cell bodies, and it's also their dendrites, whereas white matter is mostly myelinated axons, and it looks white because myelin is kind of an off-white color. So we're going to see that again. So you can see in the spinal cord, the gray matter is centrally located, whereas the white matter is peripheral. It was the opposite in the brain. The brain, remember the cerebral cortex, the gray matter was on the outside, and the white matter was on the inside. So just something different. This is the last slide of new information. So down the middle of the spinal cord, there is a little tunnel called the central canal. You may remember that CSF flows through there after it comes from lateral ventricles to third ventricle through the aqueduct to the fourth ventricle. Some of it then moves directly into the subarachnoid space, but some of it continues down then through the central canal down through the middle of the spinal cord. So don't forget that beauty. So a summary of what we just talked about, the spinal cord is housed within the bony spine, those vertebrae stacked one on top of each other, and the different levels of the spinal cord are going to be named according to the corresponding vertebrae that they're right next to. The spinal cord ends at that conus medullaris, but then we still have some nerve fibers hanging down. It looks like a horse's tail, hence the name cauda equina. Spinal nerves are coming out from every single layer of the spinal cord. In between every vertebrae, we've got a pair of nerves coming out on each side. We'll talk more about those soon. And then, of course, we have gray matter, and we have white matter, and we have that central canal. So that's it for a basic overview. I'll see you next for talking about some more in-depth features.